This is I will teach you medicine. Today we are learning about venomous snake bites, and this is under the toxicology section. So let's get started. So in Nepal, the conservatives, the snake conservatives and the wildlife conservatives, they have like suggested that estimated that there are over 20,000 cases of snake bites in Nepal, and almost in the Tarai, in the south part of the Tarai, they cause around 1,000 deaths. And then in Nepal, it has a large diversity of poisonous and non-poisonous snake, right? And it is mainly active during summer and rainy season, the snake bites. And out of that, there are 77 total species of snakes found in Nepal, and out of which 22 are venomous, right? So that is the date that it suggests. So what is the difference between venomous and non-venomous? Okay, so the difference, you should know how to differentiate it. You should be able to know. So in venomous snake, and there are the head scales, right? So usually they are small in venomous snake, but in venomous in non-venomous snakes, they are usually large. Okay, but exceptions are there. So large scales are present. The other, if the snake is venomous and it has large scales, then it has other features as well, right? So what are they? So first of all, let's see the picture, right? So this is a photo of a poisonous snake, right? So scales, this is venomous snake. The scales are very small, and compared with the non-venomous, the scales are very large, right? So these are the scales. So this is a non-venomous snake. So if the snake that is poisonous has like large scales, then it will have other special features, right? So what are they? They are opening or pit between the eyes and the nostril. Okay, so that is known as pit viper. Okay, opening, there is a pit between the eye and the nostril. And then the third lobile, okay, we will see in the figure, third lobile touches the eye and the nasal shield. Okay, that is seen in the cobra and the coral snake. Okay, so opening, like there is a pit, okay, khalto, pit between the eye and the nostril, that is pit viper. And then the third lobile touches the eye and the nasal shield, that is cobra or coral snake. And then under surface of the mouth has four infralobials, the fourth being the largest. Okay, so we'll see in the photo. So look, we can see here. So there is a large head scales, right? Large head scale with a pit between the eye and the nostril. So this is eye, this is the nostril. So what is your pit? This is a khalto, right? So this is a pit viper, and it has large scales. Okay, so this is a venomous. And then another, in cobra, you can see that this is a eye. Okay, and then this is the nostril. Okay, nose. So what happens is here, first, second and third, right? So you can see here, third lobile, touches the eye and the nasal shield. So what is seen here? This is the nostril, right? So 1 2 3, this one, eye, it touches eye and then the nostril. Okay, so third lobile touches the eye and the nostril. So this is a cobra or coral snake also. And the other one being infralobials. Okay, under surface of the mouth has infralobials, and the fourth being the largest. So this is the under surface of the mouth, right? So mouth, right? So 1 2 3 4, and this is the largest, fourth infralobials, right? So this is what. And then this all characterize, this characterizes the venomous snake, right? And then ventral belly. Okay, ventral belly or scales, ventral scales. Okay, so what are they? It is always broad and extended across the entire width of the belly. Okay, so it crosses, it is broad in venomous, but in the non-venomous snakes, it is small and like those on the back of the moderately large. Those on the back are moderately large but never extends across the entire width. Okay, so this ventral belly scales, they are like like across the width of the belly it will extend, but in the non-venomous it won't extend, right? So here's an example, right? So this is a large scale. Okay, this is the scale of a venomous poisonous snake. Okay, so it will cross the entire belly. Okay, so this is the belly and then this will cross. But in moderately large or small scale belly in the non-venomous, so it will be large in some, but it will not cross the entire belly, right? So this is not present. So this is also an important features. Another is vertebral scale. Okay, vertebral scale, so that is enlarged in crate. Okay, so vertebral scale is enlarged in crate. Yeah, so that's it. So ventral belly and vertebral is enlarged, same as that ventral, and then it is non-enlarged in the non-venomous, right? So tails, so tails of the venomous, right? Venomous are compressed. Okay, and these are round. Okay, yeah, we can see this is compressed, right? But in here it would be round or non-compressed of the non-venomous. Okay, and then fangs. Okay, fangs means the teeth, right? So it is hollow like hypodermic needles, like like needle like. Okay, and then like injection needles, right? And then it is short and solid. So fangs, so here it is hollow. Okay, this is the fangs. So if we cut the fangs like this and see, it will be a pipe like. Okay, so through which the venom comes out and then injects you like a syringe, right? So this is the venomous. Fangs are hollow. And then in the non-venomous, it is like short teeth, and they are solid, not hollow, right? And then teeth. Upper jaw has a pair of teeth modified into fangs. So same thing, it has teeth, and then upper jaw has teeth that is modified into fangs. And another is it does not have any fangs, right? All the teeth are uniform and small in size, and there are no fangs. Okay, four longitudinal rows of teeth in upper jaw and two. Okay, so the if we see the teeth, if we cut, then in the upper, this is upper, then there are four rows of teeth in the upper jaw, and then longitudinal, and then in the lower there are only two. Okay, two rows. Okay, and then bite marks. Okay, so if a snake, poisonous snake bites, then there will be only two fang marks, but in non-venomous snakes there will be more, like this. Okay, and then habit is nocturnal. Okay, venomous is like mostly like nocturnal, and then non-venomous is non-nocturnal. Okay, so I hope you get that. So venomous snake, right? So it snakes are categorized into several families, okay, based on their morphological character, including arrangement of scales, okay, depending upon their scales, dentition, osteology, myology, and sensory organs. So venomous snakes are mainly like confined into 5 families, right? So how are they classified, how are they categorized? Based on their scales, dentition, osteology, myology, and sensory organ. So this can be asked in MCQ, but you don't need more to know about it. Okay, so just remember some like small facts. Okay, so first we will come across colubridae. Okay, so these are the bloomsangs, that is birds of African continent. Okay, bird snakes like that can fly, and they are usually harmless. Okay, several species have modified salivary glands or producing toxins, but without true fangs, and rely on the trauma caused by the teeth to deliver poison. So what they do, they don't have any fangs, right? So they don't have any sharp hollow like your teeth. So but they have a modified salivary gland that can produce toxins. So how are they going to like kill someone if they have to kill? So they will cause trauma caused by the teeth on the surface, and then the toxins will get released, and then it will cause any kind of injury, right? So these are the family of the colubridae, right? And the other is they, and in colubridae they are like only few, okay, few significant injury to humans, but it does not mean that it is not possible. It is possible, right? So elapidae, so what happens is elapidae is cobra and karait, right? And mambas, and then tiger snake, taipan, and then death adder, copperhead snake, and coral snake. Okay, so all the dangerous snake that are in elapidae. Okay, elapidae. So these include cobra, crate, and then coral snake, and then copperhead snake, and mamba. Okay, so elapidae. And what happens here is they have small to moderate and sized fangs at the front of the mouth, possibly true fangs. Okay, elapidae has true fangs. And then venoms are quite toxic and are a major cause of human morbidity and mortality. So elapidae is dangerous because it has cobra, crate, and mambas, and then coral snake and copperhead snake. Okay, so what have we studied about colubridae and then elapidae, right? So now let's go to viperidae and cotalidae. Okay, viper means what does viper means? Viper. Okay, viper means viper. So Russell's viper. Okay, and then gaboon and viper, saw scaled viper, puff adder. Okay, these are all the names. You can like by heart it if you want to. So these have a well developed long fangs on the hinged maxilla. Okay, hinged maxilla they have on the maxilla. Okay, and allowing the rotation elevation when biting. Okay, so there is a maxilla and mandible, right? So in the hinged it have like hinged maxilla, okay, fangs. So it will cause what can happen, that rotation can be is possible, right, in the viperidae and cotalidae. So and then venom typically are larger, and also the venom glands are typically larger than any other group of the venomous snake. Okay, and then cotalidae including rattlesnake. Okay, viper and rattle, they are like same family. Okay, and pygmy rattlesnakes, and same thing is written here twice. And then cottonmouth pit viper. Okay, rattlesnakes and pit viper, they are the cotalidae, but here in Russell's viper, that is viperidae. So they have what they have, well developed long fangs on the hinged maxilla, so that will cause rotation, right? So now let's go to hydrophidae. Okay, so these are sea snakes. Okay, hydrophidae, hydro means water, right? So they are sea snakes, and then closely related to cobras, but with similar fang structures. Cobra and hydro, that all the sea snakes are common, but they are significant cause of mortality among fishermen. Okay, so if a fisherman who is like constantly going to the seaside, and then they are if someone says that they are bitten, then that must be due to sea snake, right? So common sense. So actra attract sapidae, okay. So these are all like hard to pronounce names for me, so please don't mind. So these are side fangs vipers like snakes confined to Africa and Middle East, and these include burrowing asp, snakes, stiletto snakes, so Atrax ripidae. So okay, um, Colubridae, Illipidae, Elapidae, Viperidae, and Cotalidae, Hydropidae, and then Atractopsidae. Okay, I don't know. I think I made some mistakes while pronouncing that. Please forgive me for that. So okay, majority of bites and consequent mortality in Nepal is attributable to five. Okay, so five types of like bites, like most these are the common, like they are very famous snakes. Okay, so these includes, we have already discussed this as well, five type. It had said like five type, but this is like second type, right? So what are they? First one is cobra. Okay, in cobra, king cobra and common cobra, common cobra. Okay, and then another is crate. Okay, crate, and that is also common and banded. And then in viper there is pit viper, Russell's viper, and saw-scaled viper, and then coral. Okay, coral. So let's look some kind of like photos. Okay, so look, this is king cobra, right? You already know without even having to study. So it has its neck like this, right? King cobra, right? So Ophiophagus hana, it is known as king cobra. Please you have to identify king cobra. So look, this is like all this. So this is the structure, right? This is the king cobra. Okay, this makes it look very very undangerous, but it is very dangerous, right? So, and this is like common cobra. Okay, and it's main very much another name is naja naja, local name, right? People also know it by naja naja. So what happens is, look at here, this is common cobra, or also known as spectacle cobra. So here we can see this is like cobra, right? But if we look at the back, so this is like spectacle, like spectacle shaped marks on the on the back part, right? So this is the mark. So if this mark is present in the snake, then it is common snake, right? That is a common like cobra, right? Common cobra, that is naja naja. So we can see various photos, all this. Okay, spectacle shaped on the back of the neck. Okay, and yeah, that is seen. Okay, and another is, now cobra is done, right? So now let's go to common crate. Okay, common crate, that is crate. Okay, that is common, most common we can see. Okay, and another is banded crate. Okay, so common crate, we can see like it is not a cobra, right? Obviously not a cobra. And then look all this pattern, right? This is a common crate. Okay, and here what happens is, enlarged row of scales along the vertebral ridge and light rings across the posterior body. So it has a row of scales along the vertebral ridge. Okay, along the vertebral ridge. So this is a venomous, right? We already studied about that, venomous and non-venomous. So ventral scales and vertebral scales, right? So these are all across along the vertebral ridge, and there are like light rings, right? So these are the rings across the posterior body, right? So you can see that this is a common crate. But if there is a, like something like this, okay, so this is a banded crate. Okay, this is yellow color, very pretty snake, something I would never say in my lifetime. I don't know, but why did I say it? But it's very like pretty color, right? Yellow and black, right? So this is a banded crate. Okay, so you have to like understand, you have to see, then you have to just know, identify the snake, right? This is banded crate, and this is the common crate, right? So now let's go back to our viper, right? So viper, these are very dangerous, like these are found in deserts and all. See, so dangerous pattern and all. It has almost like very artistic pattern, I would say, right? So these are the saw-scaled viper. Okay, viper. And then there is another one. So if it is pretty, or any kind of like pretty, or I mean like in artistic pattern, then it is a viper. Most likely it is a viper, right? So see all these patterns, all these dots, polka dots, like, right? And look at this looks like some marble and all, and like a palette of colors, so this is artistic, very artistic, I would say. So this is like, this is a saw-scaled viper, right? And this is the Russell's viper is like this. Okay, in polka dots, like. And then another is Kramer Pitts like viper, right? So look at this is a viper. Okay, green color, artistic, green color, that is viper. And then yeah, this is a Kramer's pit viper, right? Pit viper, Russell's viper, and then saw-scaled viper. And you can see again here pit viper. So these are artistic pattern, that is a viper. And then look at this, that is not Kramer's, this is not saw-scaled. So what happens, this is a pit viper, right? So you have to exclude like that. And then let's come to coral snakes, right? So in coral snake, we can see that like it is not cobra, right? And it is not crate, it is also not crate, and then it is also not viper, right? You have to exclude like this if you are very confused. So what is this? This is a coral snake. So these are venomous, okay? So coral, look at this, this is not like, this has colors but it is not like a viper, right? So look at this, this is like coral snake, okay? So you have to know this very much. Looks like roberty kind of snake, right? So among the various species, the average yield per bite in terms of dry weight venom, okay? So one bite, so if you collect, okay, so this is a jar, okay, and this is a snake, right? So its fang is coming out like this, and you are making it to spit, the venom on the like on the container. So average yield per bite, okay, one bite have how many, like a dry weight of venom. So if it is cobra it is 60 milligrams, and then Russell's viper, that produces dry weight dry weight of venom, that is 63, and then crate is 20, and then saw scaled viper has like very less saw scale, that is 30 milligram, okay? So Russell's viper is 63, saw scaled viper 13, cobra is 60, and then crate is 20, right? So respective fatal dose and are much smaller, that is for cobra its fatal dose is just 12 mg, right? So out of 60 mg, only 12 mg, one bite like it can kill, right? And in the Russell's viper, it has 63 mg, right, but only 15 mg can kill. So it is like very much like emergency, right, if a snake bite occurs. And in the crate, it has like 20 milligram of dry venom, but only 6 milligram, okay? So it has 3 times, okay? So 3 times venom is injected if that are fatal to a body, if like a crate has like beaten you, right? And then 13 mg for saw scaled viper, and then in saw scaled viper only 8 mg is fatal dose, right? So let's read about snake bites. Snake bites occur in all parts of the Nepal, but is more common in Tara and some valleys of the middle hill region, where there are tropical climate that favors the snake, right? Obviously, in the developing country like Nepal, accurate data is very hard to obtain. Snake bite is common event even in rural areas where transportations and medical facilities are grossly inadequate, right? So these are farmer and then tropical climate of the Nepal. So what is this? This is a fang mark, right? So 2 fang marks, that is a venomous snake. So we can see here mostly north south, right? So this is southern area, right? Southern area. And in the Tarai, this is the Himal, this is the Pahad, and this is the Tarai, right? So in this part are most affected, and then other like hilly region as well, like all like tropical climate, here also we can see some kind of snakes, okay? But in the mountain region, no snakes can be found, right? At least like not that dangerous types. So we have already like studied about the family. Illipidae means cobra, crate, and coral, and then they have toxin, okay? They work on the neurons, okay, the CNS. And then hydrophidae, that is snake, they are myotoxins. And then viper means hemotoxic, okay? So the venom, okay, the venom are always categorized into either neurotoxin, myotoxin, and hemotoxin, right? So neurotoxin, cobra, crate, and coral, these venoms. Myotoxin, sea snake, and then hemotoxin, that is viper, right? So this is very important fact to know, please note it down if you are reading. So snake venom, okay, let's read about the snake venom. So snake venom is the poisonous secretions, right? That is saliva of the snake, okay? It is a saliva ejected from the poison apparatus, that is either modified parotid gland, or in some cases that is a modified salivary gland, okay? And then it is a modified parotid gland. MCQ questions can be asked. So snake venoms are usually clear amber colored when freshly ejected. On the exposure to sun, they become slightly turbid, okay? On drying the potency remains the same as the liquid state. So dry state also is equally potent. And snake venoms are poisonous only when injected or through a bite. but not when taken orally, because it will be digested by the enzymes in the interstitial tract and absorbed as amino acids. So what are they? They are all like proteins, right? Venoms are proteins. So it should be injected into the blood, right? If it is not injected into the blood and it is like digested through the oral route, then it will not cause any kind of symptoms, okay, unless there are ulcers and then like varices in the esophagus and the stomach. So that will cause like it will get into the blood mixed. But if there is like no kind of any kind of like those diseases, then what happens is it will get digested and absorbed as amino acid, and they are excreted by kidneys, okay, and milk, probably by the salivary glands and the mucous membrane, okay. So toxic principles in the snake venom, okay. So toxins are always low molecular weight peptides and proteins, okay. They are peptides and protein at the end of the day, okay, and amino acids. So that will, if it will break down, it will give down amino acids, right? So what are the like enzymes, okay. So enzymes and toxalbumin, okay, we will read about enzymes and toxins. So cholinesterase neurotoxin, anticholinesterase cardiotoxin, hyaluronidase hemolysins, lecithinase cytolysine, phosphatidase agglutins, they cause agglutation, phospholipase A, this will called hemorrhagin, and then protease is hemolysin, and proteinase is fibrinolysis, and ribonuclease and deoxyribonuclease, it is a proteolysis, right? And then opioidsidase, that is thromboplastin, these all will cause any kind of like like they will mess up your blood and then coagulation, and then it will like cause the symptoms, right? So and then it will also cause like it also has ATPase and then transaminase, okay. So you have to buy hard this, okay. Cholinesterase neurotoxin, anticholinesterase cardiotoxin, hyaluronidase hemolysin, lecithinase cytolysine, and then phosphatidase agglutins, okay, that is it. So types of the snake venom, okay, we already discussed like neurotoxic, myotoxic, and hemotoxic, right? So let's start neurotoxic, okay. It is common in elapidae, that is crate and cobra, okay. Elapidae, okay, elapidae, crate and cobra. So action, it has like curare, okay, acts like curare, we will read also about that. And it will act on the motor nerve cells, okay. So because it is a neurotoxin, it will on the motor nerve cells, okay, and results in muscular paralysis, okay. And the muscles being affected in the order, that is first like which muscles will be affected first, the mouth of the, like muscles of the mouth will be affected, and then the throat, and then the respiration, okay. It will like come down, okay, from the mouth to throat to lungs, okay. So that is the order of the muscle, or the pattern of the muscle that is affected by neurotoxin. So local action, what happens locally, okay, severe burning at the site, at the bite site, rapid edema and inflammatory changes followed by oozing of the serum. So this is very common, right? So um, and then in the systemic action, okay, locally what it does, it will cause burning at the bite site, okay, of course, and then edema, inflammatory changes, and then serum will ooze out, right? So systemic action, what happens is found within 15 to 20 minutes of biting, and then what happens is giddiness, weakness, lethargy, muscle weakness, followed by a rapidly spreading paralytic syndrome, which progresses to bulbar paralysis, okay. And then what happens is paralytic syndrome as it progresses right? So it will cause like bulbar paralysis, and then respiratory failure, coma, and death, okay. So this is what it's seen by. So it is a rapidly spreading paralytic syndrome, okay. Or will this is the local, like you have seen in the movies and all, you can make out of that. But like paralytic syndrome that spreads, progresses to bulbar paralysis will lead to respiratory failure, coma, and then death, right? So convulsions may be seen with the cobra venom, okay. Any kind of convulsions can be also be seen with cobra venom. So let's talk about hemotoxic venom, okay. So hemotoxic means viperidae, that is pit viper, and then pitless viper, that is Russell's viper also, and then saw-scaled and bamboo snake, okay, saw-scaled viper also. So action, it acts by the cytolysis of the endothelium of the blood vessels, okay. Hemotoxic means cytolysis of the blood vessel. So if this is a blood vessel and this is like endothelium, okay, this is a cross section, right? So please try to figure out what I'm drawing here. This is the endothelium. So what happens if this toxin comes here, it will cause lysis of the cell, okay, of the lysis of the red cell and other tissues, okay, and the blood vessels, and then which will cause coagulation disorder. So what happens is local action, that is severe pain at the bite site followed by the swelling, ecchymosis due to blood hemotoxin, right? And then cellulitis, and then hemorrhage, okay. It is related to blood hemotoxin, that's why. And then systemic effect is like if blood is like hemolyzed, in massive amount, so hemolytic effects on the heart, blood vessels, causing cardiovascular collapse, okay. So hemorrhage from the mucosa of the rectum and other natural orifice. So all the mucosa of the rectum and the natural orifices where there are opening, it will cause hemotoxin, will cause hemorrhages, right? So gangrene of the involved part. So gangrene can also occur. Then it will also affect the kidneys by causing necrosis. Okay, and then convulsions is due to intracerebral hemorrhage. Okay, so intracerebral hemorrhage, there will be hemorrhage, then it will cause CNS symptoms, so it will cause convulsions, right? So now let's move on to myotoxic venom. Okay, myotoxic venom is like common in hydrophilia or sea snake. Okay, sea snakes that can cause myotoxic venom. Okay, local action, it causes swelling and pain at the bite side. Okay, it is same thing, but systemic action is like generalized muscle pain and muscle stiffness and myoglobinuria. Okay, so myoglobin will break down into lot and it will present on urine, so myoglobinuria. And then RTN, okay, that is renal tubular necrosis. Renal tubular necrosis will also occurs with myotoxic venom. So this is again the difference between the poisonous and non-poisonous. Okay, it comes about the scales and then triangular head and the rounded head. Okay, triangle, if it is triangle, then it is most likely poisonous. Okay, and then other things, and then fangs, and then pit nasal labial, that it will touch or not. And then no fangs, rounded pupil. Okay, this has elliptical pupil. Okay, so this is elliptical, that is poisonous, but if it has round pupil, then it is non-poisonous. And then anal plate. Okay, so it has a single row of the subcaudal that plates, right? And then in the another in non-venomous, that is a double row, and then row of subcaudal plates, right? Subcaudal plates. Okay, that's it. So snake bite teeth pattern, right? So elliptical pupil, and then you can see only two fangs. Okay, but in non-poisonous, it will have like multiple bites. Okay, teeth marks. Okay, so we can see that. So venom comes from the parotid and then like this into the hollow cavity of the fangs, and then it will be injected just like a injection, right? So that's it. So signs and symptoms. Okay, so fear. Okay, whenever a snake bites you, so what will you do? You will fear, right? So fear. And then effects of local treatment, and the venom of the venom contribute to the symptom and sign of the snake bite. Okay, so even patients who are not envenomed may feel flushed, dizzy and breathless, and may notice constriction of the chest, palpitations and sweating. Okay, so if any kind of non-venomous snake bites also, you will feel like all this signs and symptoms, right? You will feel dizzy, maybe because of psychological, but also you can feel it. Okay, dizzy, breathless, and then may notice the constriction of the chest and palpitation and swelling. So what and then other is tight tourniquets. Okay, so some people will local people will they will wrap around tourniquets. Okay, based on the old thinking and then superstitious beliefs, but it can produce like swollen and then ischemic limbs. Okay, so no blood can go to the limbs, and then that will cause swollenness, and then it will cause this can also be occur. So in Nepal, bites by non-poisonous snakes are more common than bites by poisonous snake. Okay, so you should always remember that. And then bites by the poisonous snake may not always result in envenoming. Okay, however, the patient should still be admitted in a hospital for observation. So poisonous any bites by the poisonous snake may not always result in envenoming, right? So we should administered regardless, right? And then the earliest symptoms directly attributable to snake bite are local pain. Okay, and then bleeding from the fang punctures. Okay, and then followed by pain, tenderness, swelling and bruises. Okay, and then nausea and vomiting are common early symptom of the systemic envenoming. Okay, so the venom has worked. So hematotoxic. Okay, hematotoxic means 20 minutes blood clotting test. Okay, doesn't if even after 20 minutes, if the blood doesn't clot, then that is venomed. So yeah, that's how we find out if the snake is hematotoxic or not. So first aid, right? Very important. The most important aspect of the pre-hospital care of a person bitten by a venomous snake is rapid delivery to the medical facility equipped to provide supportive care. Okay, so first aid, there are no any kind of hi-fi first aid you can do. So the most number one thing you should do when a person gets snake bite is you have to help them to get to a hospital. Okay, hospital or of medical facilities that can provide supportive care, so airway, breathing and circulation. And then we also should know where the antivenoms are available. Okay, so so it is mostly available in like government hospitals and then these army hospitals, right? So anti-venom administration, so you should take like the patient to the hospital that has anti-venom administration, right? So another is the patient should be reassured, okay, and the whole patient should be immobilized, okay. So you should not like move the body part that is like bitten, right? And then most traditional first aid methods are potentially harmful, okay, like tight tourniquet, and then we it is also like said that like you should, if there is a fang the bite mark, so you should cut it and let the blood flow and all that, and somebody even say to suck out the venom, right? So that's only possible if you don't have any kind of oral ulcers, so that it could be like it would be like injected. So and tight tourniquets are potentially dangerous as they can cause gangrene and peripheral nerve palsies, okay. So this is not this is very important thing. So what not to do in snake bite, right? So do not allow the victim to become over exerted, okay. So reassure, tell them it's going to be okay, and then say that don't worry too much and all, and do not apply a tourniquet, and do not try to suction a venom by mouth, especially if you have ulcers like aphthous ulcer and then all that, okay. And do not give the victim stimulant, and do not raise the site of the bite above the level of the victim's heart, okay. So that will cause like more circulation, and then it will like spread systemically it will spread. So do not raise the site of the bite above the level of the victim's heart, right? So we can also, what we can do is we can do compression bandages, okay. So prevent venom from draining from the initial lymphatics into the circulation, okay. So venom, like it will, compression bandage will inhibit, okay, drain into the lymphatic and then circulation. So it should be above the wound up to the next joint, okay. So suppose there is a bite, so it should be above the wound in the next joint, okay. So this is the knee, right? So up to here, okay. Bandage should be tight enough to occlude the superficial venous and lymphatic return, but not the artery, okay. So just bandage, okay, just compress the tight, okay. So why is this done? To like to inhibit, to drain, to prevent the drainage of like into the superficial vein and then lymphatic region, so that it cannot like go more complicated, right? But not so tight that it will block the arterial or the deep venous flow. So okay, so this is how it's done, compression bandage. So that's how it is done. So like diagnosis, okay, in labs how the snake bites are diagnosed. So snake specific venom antigens, are in the wound, detected in the wound swabs, okay, aspirates and biopsies, and serum, CSF, urine and other body fluid. Snake specific venom antigen is seen, okay. And then RIA, that is radio immune assay, is the most sensitive and specific, which can detect venom levels of 0.4 microgram per liter, okay, gram per liter, okay. And then EIA, enzyme immune assay, is common, okay, but most sensitive is RIA, that is radio immune assay, and then commonly used and is simple, okay. So it can develop up to 50.4 microgram. And then cholinesterase and thromboplastin, okay. So cholinesterase and thromboplastin, these are all the like properties, right? Maybe in the detectable in the biting area of the skin, if there is no if there is no bacterial infection or putrefaction has occurred in the snake bite area, then we can find cholinesterase and the thromboplastin. And then another is immunological detection of the same and small amount of venom antigen in the body fluid can be done by ELISA, okay. So what are they? First we have to do that snake specific antigen, venom antigen in like blood and all, CSF and all. But another is RIA, that is radio immunoassay, that is the most sensitive and specific. And then like EIA, that is enzyme immunoassay, that is like very commonly done, okay. And then cholinesterase and thromboplastin on the site of the bite of the snake if there are no putrefaction or bacterial action, right? And then in the body fluid, what we can see is like amount of venom in that is ELISA is also done. So okay, so RIA, RIA, PIA, PIA, right? Sorry, EA, sorry, RIA, radio immunoassay, enzyme immunoassay, and then like ELISA, okay. And then a swab taken from the wound from the skin is injected to the frog, okay. So what we do is we kill the frog, right? So a swab taken from the wound site, and then extract from the skin is injected into the frog to see if it dies or not. So if it dies, it is toxic, right? So what we do is, So in the treatment, again we will read about like treatment. Okay, so patient is being transported to the hospital and should lie on their left side, okay, in the recovery position to prevent the aspiration of the vomiters. Okay, and then left recovery position, and then persistent vomiting can be treated with antiemetic. Okay, antiemetic can be given. So what are the other like happens is like syncope, shock, angioedema, and other autonomic response that can be treated by adrenaline and antihistamine. So patient with incoagulable blood will develop the hematomas after intramuscular and subcutaneous injections, right? So IV route whenever possible is possible. Okay, so except in the case of adrenaline that is given IM, right? So adrenaline, if adrenaline should be given only with cautious, we should give in intramuscular, but other any kind of drug should be given by IV route. Okay, so and respiratory distress and cyanosis should be treated by clearing the airway, and then giving oxygen. Okay, so like the chest constricts, right? So we should do assisted ventilation if required. Okay, even tracheostomy. If the patient is unconscious and no femoral or carotid pulse can be detected, cardiopulmonary, CPR can be done if there is like no femoral and then carotid pulse and then patient is unconscious. Okay, that CPR is initiated. Okay, so the most important decision is whether to give or not give antivenom. Only the specific antidote for envenoming. Okay, the only specific antidote. So there is abundant evidence that in patient with severe envenoming, the benefits of this treatment outweigh the risk of the antivenom reaction. Okay, so that is known as AVR, antivenom reaction. Okay, so we should always decide whether we should give the antivenom or not. So like if we give antivenom, so if we decide to give antivenom, so it should be like the benefits of giving the antivenom should be more than the like risks of side effects. Okay, so side effects will be less. Okay, so it's like a like tarazu, right? So it's like a tarazu, so you wait, okay, whether to give antivenom or not. If the useful benefit is more than risk or side effects, then use antivenom. Okay, so this is then use antivenom, otherwise don't. Okay, so this is a very important. So look at here, this is a snake venom, that is antiserum. Okay, and that is polyvalent enzyme refined equine antivenom immunoglobulin fragments. Okay, so this is the same. So another is, okay, now let's go to types of antivenom. Okay, so this is very important thing, and then we are about to like we are very close to in this lecture, so let's stick with me. Okay, so more like 20 minutes more. Okay, so types of antivenom. So it is a monospecific, let monospecific. Okay, so what happens is this is the optimal treatment when biting snake has been identified with certainty. Okay, so monospecific, very specific, right? So if you know if a person is bitten by a king cobra, then you have to give the monospecific antivenom, right? And then polyvalent antivenom is, it is useful for biting when the biting snake hasn't been identified. Okay, so polyvalent, so it has a higher range. Okay, so polyvalent anti-snake venom is prepared by hyperimmunizing the horse against the venom. Okay, hyperimmunizing the horse against the venom of the 4 common poisonous snake, that is cobra, common krait, Russell's vipers, and Echnis carniata. Okay, carinata. So it is effective when given within 4 hours of the bite. Okay, it is given within the 4 hours of the bite, and then less value after 8 hours, and then doubtful after. Okay, so if 4 hours, if the patient comes, then it will be very effective, and then 8 hours, then it will be less value. Okay, and then after 24 hours, you don't know if the person will like live or not, it will survive or not. So each vial neutralizes 6 to 8 milligrams of venom, so its half-life is 90 hours. Okay, so you have to calculate in that way. So dose, minimal symptoms. If there is minimum symptoms like local swelling but no systemic reaction, then 5 vials. Okay, and then moderate, that is swelling progressive behind the site of the bite and systemic reaction, 10 vials. Okay, 5 10 multiples of 5. Okay, so severe is 15 because there is like systemic syndrome symptoms and then local reaction and all that. So the lyophilized powder is diluted in 500 ml of the normal saline and infused over 30 to 60 minutes. Okay, and then in neurotoxic poisoning, a second dose of 10 vials should be given at after 1 hour. Okay, second dose of 10 vials in neurotoxin after 10 hour, after an hour should be given. So in also same way, hemotoxic poisoning, the initial dose of the antiserum will be neutralizing unbound free floating venom. Okay, and then the liver requires 6 hours to restore clotting factors. Okay, and hence such patient will not require further antivenom for 6 hours after the first dose. Okay, so this is also very important thing to know. So on the general measures, the first sign is urticaria, right? Itching, shivering, chills, nausea, vomiting, hypotension, bronchospasm, angioedema. So what we do is we should stop the PAV, polyvalent serum infusion, right? Polyvalent anti-snake venom, right? So we have to stop the polyvalent anti-snake venom. So administered 0.5 mg, that is 1 is to 1000 ratio of adrenaline for IM intramuscular route for adults, okay, and then 0.01 mg per kg for children. And then we have to give the hydrocortisone, steroid and antihistamine for long-term protection, and then repeat the second dose of adrenaline if no effects within the 10 to 15 minutes, and then we have to continue the anti-serum infusion after the condition has improved, right? So if the anti-snake venom is not available, then what we do is 40 ml of anti-venens is given IV, okay, so repeated as required, okay. And then when treating a viper bite, watch should be kept on the prothrombing time, okay, PTT should be calculated. And then if there are signs of neuroparalysis, then neostigmine should be given, right? And then with atropine, okay, atropine. So and then it should be given like 10 minutes interval, okay, and then if necessary, and then heparin for all the clotting abnormality. The normal dose is 1000 to 5000 international unit, right? So and then tetanus toxoid and antitoxin should also be given, and then a broad spectrum antibiotic if there is like bacterial growth and all, okay, but you should do that prophylactically. In viper poison, viper poison, right? So we have to give sedatives to allay the pain and anxiety, okay. And then if there is a like bulbar paralysis and respiratory failure, so we have to do mechanical ventilation support. And then if required, we can do blood transfusion and then hemodialysis or peritoneal dialysis, right? So anti-venom is indicated if signs of systemic envenoming present, okay. So we have already discussed about it, but also let's again discuss about it. So hemostatic abnormalities, spontaneous systemic bleeding, incoagulable blood or thrombocytopenia, if these are like present, then we should do anti-venom, anti-venom anti-snake venom, right? So neurotoxicity, so if there is like descending paralysis, we starting with ptosis and then external ophthalmoplegia, so we should start the anti-venom like envenoming, okay. And then hypotension and shock and abnormal ECG, and then any kind of severe cardiovascular dysfunction, then anti-venom is indicated. And then black urine, okay, due to rhabdomyolysis and then hemolysis, okay, the intravascular hemolysis, that will cause black urine. And then supporting evidence of the severe envenoming is a neutrophil leukocytosis, okay. So neutrophils will be increased, and elevated serum enzymes such as creatinine kinase and aminotransferase CK and aminotransferase will be increased. And then hemo concentration, and then severe anemia due to breakdown of the RBCs and myoglobinuria, okay. And then hemoglobinuria, all these hemoglobin are present in blood, and methylglobinuria, and then hypoxemia and acidic, okay. So these are all will be present, okay. So in the absence of systemic envenoming, these are indications for antivenom, especially in patients bitten by species where venoms are known to cause local necrosis, okay, that is viper and cobra, okay. So local swelling involving more than half the bitten of the limb, extensive blistering or bruising or bites on the digit, and then rapid progression of swelling. So this is the common scenario in hospitals, okay, snake bite victims at the zonal hospital. So now only little bit slides is left, okay, so please stick with me. So selection, dose and administration of the antivenom, how antivenom is like selected, and then what is the dose and how it is administered. Whatever the stated expiry date on the vial, opaque solution should be discarded, okay, as precipitation of proteins indicate loss of activity and increase the risk of reaction. So if there is like expiry date is present, then you should throw that, okay. And then monospecific, that is monovalent anti venom should be choose if you know the species that has bitten the patient, okay. And then polyvalent if you don't know which species of the snake has bitten you, okay. So antivenom is available and it's freeze dried powder, okay. So polyvalent will be in the form of powder, okay. And then what we'll do is vial has to be diluted with 10 ml of sterile water for injection, okay. So powder is mixed with 10 ml of sterile water and then put in the injection and given intravenously, right? So the freeze dried powder protein may be difficult to dissolve and may take few seconds to minutes. Okay, so two methods of administration of reconstituted freeze dried antivenom. Okay, so two methods of reconstituted freeze dried. Okay, so it can be given by the IV bolus, slow, not more than 2 ml per minute, and then another is IV infusion. Okay, that is 5 to 10 ml of isotonic fluid. That is normal per body weight. Okay, so that should be given in Nepal. In practice of Nepal, some doses of antivenom are given as IV bolus, same as and some as IV infusion in isotonic fluid. Okay, bolus or isotonic fluid we can also give snake venom antiserum, right? So what is the suggested initial dose, okay, for polyspecific antivenom for naza or spectacled cobras, remember that, and then common crate, and then Russell's viper, and then involving is 100 ml. Okay, so even 100 ml of antivenom for 1 to 2 hour is given, for cobra, that is common cobra, and then common crate, and then viper, Russell's viper, that should be given only 100 ml of snake venom. So however, total dose of antivenom may vary. Okay, so from 50 ml to more than 300 ml, so it depends upon the severity of envenoming and then potency of antivenom and response to antivenom. So that can also do. So now anti snake bite venom, right? So in case of if you give anti venom, what it can cause side effects, right? So what are the reactions? So at first, the signs of acute reaction, that is urticaria or mild itching, or may present as bronchospasm, okay, or cardiovascular collapse, then we should stop the ASV. Okay, so what should we do? So if there is toxic side effect, then we should do adrenaline, that is 0.5 to 1 mg intramuscular, at the site of sign of reaction, and then repeat every 5 to 10 minutes. Okay, and then chlorpheniramine, that is histamine, antihistamine, right? So it should be given, and then hydrocortisone, that is a steroid. Okay, 100 mg IV stat. Okay, so one ampule of chlorpheniramine, and then adrenaline and hydrocortisone should be given. So oxygen therapy should also be given, and then if there is a secretion, then we should do suction, right? So once the reaction is controlled, if the severity of the envenomation warrants additional antivenom, those should be diluted further in isotope. So you have to very dilute. Okay, so why it happens is because of more administration of ASV, like anti-snake venom. So we have to dilute the anti-snake venom, and then we should again restart, okay, as soon as possible. So monitor this patient should be monitored very closely, preferably in ICU, okay, and during such therapy. And then another is a local wound. Okay, so how you will clean the local wound? So it should be cleaned with dilute antiseptic detergent, and then bulle are best. If there is a formation of bulla or bulle, then we should leave it behind. Okay, and then local wound, we should also give booster dose of tetanus toxoid and antibiotic. And then if there is a definite signs of necrosis, then surgical debridement, you have to remove it, and then immediate slit screen grafting and broad spectrum antibiotic is also given. Okay, so now most important part of the snake bite is post-mortem appearance. We are reading in forensic medicine, right? So and toxicology. So post-mortem appearance of the snake is poisonous snake leave two or sometimes one fangs marks, while non-poisonous snake leaves a semicircular set of tooth marks, right? So you can see the bite mark in the post-mortem appearance. So punctures are only 1.5 centimeter deep in the colubrine. Okay, 1.5 centimeter in the colubrine and 2.5 centimeter deep in the viperine bites. Okay, so that should also be taken in note. Okay, that should also be taken in the postmortem appearance. So colubrine bite mark contain fluids and hemolyzed blood causing staining of the vessels, which while viperine bites mark shows discoloration, swelling. Okay, so if the colubrine bites, then there will be staining. Okay, staining of the vessel will be seen, but if the viperine bites, then there will be discoloration, swelling, and the cellulitis. Okay, so colubrine death, the change in the internal organs will that of the asphyxia. Okay, so colubrine death, you can see same features that of the asphyxia. So but in viperine death, changes of the hemorrhage in the lung. Okay, asphyxia means water, but in the viper we will be hemorrhage in the lungs, pleura, pericardium, renal tubular necrosis, discommation, cloudy swelling in the kidneys, that will occur in viper. So what is the medical legal importance of snake bite? So it can be as a rule are usually accidental. Nobody bites snake. Okay, but there is one homicidal or suicidal case. This is ancient Roman or Greek story, I don't know, but Cleopatra. Okay, so Cleopatra, they are homicidal. That one queen or something like that died from suicide by snake bite. Okay, so cattle poisoning by snake venom is practiced in different part of the India in hide business. Okay, so please Google about hide business. This is very interesting. interesting thing. The venom at the bite site is identified by detecting cholinesterase activity in colubrin. Colubrin means cholinesterase, and then viper means thromboplastin. Okay, so venom can be identified. So yeah, that's it for the venomous snake bites, guys. Thank you for watching. If there is like anything, if I had made any kind of mistakes while making this video, then please let me know in the comment. And if there are any kind of things left, or any kind of thing, any kind of information I missed, or anything I made, I didn't make it clear for you, then please leave a comment and consider subscribing. Thank you.